Hi, my name is Alicia Marks, and this is an educational video on immunity and vaccinations for Nursing 110 Medical Surgical Nursing through the University of Charleston. I'm going to start by telling you a little bit about immunity. So immunity is the ability of the human body to tolerate the presence of material indigenous to the body, or self, and to eliminate foreign non-self material. This discriminatory ability provides protection from infectious disease, since most microbes are identified as foreign by the immune system. Immunity to a microbe is usually indicated by the presence of antibody to that organism. Immunity is generally specific to a single organism or a group of closely related organisms. The most effective immune responses are generally produced by response to a live antigen. However, an antigen does not necessarily have to be alive, as occurs with infection with a virus or bacterium, to produce an immune response. There are two different types of immunity, active immunity and passive immunity. So active immunity is an adaptive process that allows the body to make antibodies in response to the entry of an antigen into the body. Active immunity develops over several weeks to months and is long-lasting, whereas passive immunity is short-lived and develops when antibodies that are created by another human or animal are transferred to the client. Because the client does not independently develop these antibodies, passive immunity is then temporary. Both active and passive immunity have two subtypes of immunity, artificial and natural. So active natural immunity, as it is an active type of immunity, is long-lasting. It develops when the body produces antibodies in response to exposure to a live pathogen that enters the body naturally, such as contracting chickenpox, COVID-19, or the flu. These are genetic immunities. Passive natural immunities occur when antibodies are passed from the mother to the fetus or newborn through the placenta or the breast milk. An active artificial immunity develops when a vaccine is given and the body produces antibodies in response to exposure to a killed or attenuated virus. Like when you get a vaccination for measles, mumps, and rubella as a kid, you developed an active artificial immunity. Passive artificial immunity occurs after antibodies, also known as immunoglobulins, are administered to an individual who requires immediate protection against a disease where exposure has already occurred, such as following a bite from an eastern diamondback rattlesnake. Say in this instance, you would then be prescribed Crofab, which contains immunoglobulin fragments obtained from the blood of healthy sheep who have been immunized against several North American venomous snakes. This might be administered at this time. Now I'm going to tell you about some of the most common immunizations. So Tdap is a combination vaccine that protects against three potentially life-threatening bacterial diseases: tetanus, diphtheria, and pertussis, also known as whooping cough. It is given once, usually during adolescence. The TD vaccine is the tetanus diphtheria booster, and it is given every 10 years. For adults 19 and older who did not receive a dose of tetanus, diphtheria, and pertussis, Tdap previously, substituting the first of these doses with Tdap is normally done, and then 10 years subsequently after that, they're going to get the booster. Also, pregnant patients should receive the vaccine between 27 and 36 weeks gestation, and this should be done with each pregnancy to protect the fetus from pertussis. The MMR vaccine is a combination vaccine for measles, mumps, and rubella, following recommendations for administering 1 or 2 doses to clients between the ages of 19 and 49 who lack documentation of immunization or prior infection, or a laboratory proof of immunity. People born before 1957 are considered immune to measles and mumps. A client who is pregnant should not receive MMR vaccine. Anaphylactic-like reaction to gelatin or neomycin is also contraindicated for to not administer MMR vaccine. Use caution when administering to a client who has a history of thrombocytopenia or thrombotypic purpura. Do not administer MMR to a patient who is severely immunocompromised. Then the varicella vaccine protects against chickenpox and the subsequent herpes zosters that would result. Give 2 doses to an adult who does not have evidence of previous infection. 1 dose depending on the type of zoster vaccine, and give 1 dose to adults who had already had a previous dose. Varicella vaccine is contraindicated for clients who are pregnant, have some cancers, are immunocompromised, or have hypersensitivity to neomycin and gelatin. The vaccine is not recommended for clients who have HIV, congenital immune deficiencies, or those taking immunosuppressive medications. Precautions should be taken with patients who have had blood product containing antibodies within the last 11 months. Treatment with antiviral medication within 24 hours prior to immunization. Avoid taking antivirals for 14 days following immunization. And also take caution with extended use, 2 weeks or longer, of corticosteroids or other medications that affect the immune system. The pneumococcal vaccines are vaccines against the bacterium Streptococcus pneumoniae. And their use can prevent some cases of pneumonia, meningitis, and sepsis. And these are there are 2 types of pneumococcal vaccine. So there's the pneumococcal conjugate vaccine, which is also known as PCV13, and the pneumococcal polysaccharide vaccine, which is known as PPSV23. And a conjugate vaccine is a type of vaccine which combines a weak antigen with a strong antigen as a carrier. So the immune system has a stronger response to the weak antigen. Polysaccharide vaccines are a unique type of inactivated subunit vaccine composed of long chains of sugar molecules that make up the surface capsule of certain bacteria. The immune response to a pure polysaccharide vaccine is typically T-cell independent, which means that these vaccines are able to stimulate B cells without the assistance of T-cell helpers. And then the 13-valent pneumococcal polysaccharide vaccine fights 13 causes of pneumonia. So 23-valent pneumococcal polysaccharide vaccine fights 23 causes of pneumonia. And following recommendations for administration to adults who are immunocompromised, have specific chronic diseases, smoke cigarettes, or live in long-term care facilities, you're going to want to follow those specific recommendations. PPSV23 does not work in children younger than 2 years old. For adults 65 years and older who have not been immunized with PCV13 or PPSV23, administer PCV13 first and then give PPSV23 between 6 to 12 months after that. Do not administer both during the same visit. For adults who receive a dose of PPSV23 at age 65 or older, an additional dose is not indicated. And PV13 is contraindicated in patients who have had anaphylactic reaction to a vaccine containing diphtheria toxoid, and also PPSV23 is contraindicated in pregnancy. So now I'm going to tell you a little bit about hepatitis A vaccines. So hepatitis A is given in 2 doses to high-risk individuals. So 1 month after the first dose of hepatitis A vaccine, 94 to 100% of adults and children develop a protection level of antibodies. Adults who receive a second dose have 100% protective levels of antibodies after 1 month. With hepatitis B, administer 3 doses to high-risk individuals who lack completion of the series. There must be at least 1 month between doses between doses 1 and 2, and at least 2 months between doses 2 and 3. And then a minimum of 4 months are required between doses 1 and 3. So clients have a greater than 85% protection after the second dose of hepatitis B vaccine and more than 90% after the third dose. The antibody duration of protection is 5 to 7 years. There is no vaccine for hepatitis C, but it is curable. Influenza vaccines, also known as flu shots or flu jabs, are vaccines that protect against infection by influenza viruses. New versions of the vaccines are developed twice a year as the influenza virus rapidly changes. And there are 3 different types of influenza vaccine. So inactive, recumbent, and live attenuated. The influenza vaccine is recommended for adults annually. An active influenza vaccine, also known as IIV, is approved for clients who are pregnant. Recumbent influenza vaccine, also known as RIV, is approved for adults 18 years and older. The live attenuated vaccine, also known as LAIV, is given for adults under age 50 who are not pregnant or immunocompromised. And clients who have allergies to chicken eggs or previous severe reaction to the influenza vaccine or previous Guillain-Barré syndrome should not receive the influenza vaccine. Administration recommendations can change yearly because the vaccine is created with different influenza strains each year. The vaccine is typically available beginning in early fall if you do have an egg allergy. The concern here is that most flu shots and the nasal spray flu vaccine are manufactured using egg-based technology. So the good news is that the recombinant and cell-based influenza vaccine are safe for those with egg allergies. So the recombinant vaccines are created synthetically and do not use egg-grown vaccine virus or chicken eggs at all in the production process. And the name cell-based influenza vaccine refers to how the flu vaccine is made. So most inactive influenza vaccines are produced by growing influenza virus in eggs. But the influenza viruses used in the cell-based vaccine are grown in cultured cells of mammalian origin instead of in hen's eggs. So the cell-based inactivated influenza vaccine was licensed by the FDA for use during the 2019-2020 flu season, and there's only one on the market. If you haven't heard about it, if it's not in your textbook, that would be why. The HPV vaccine protects certain strains against human papillomavirus that are the most commonly transmitted sexual infection. High-risk HPV strains include HPV 16 and 18, which causes about 70% of cervical cancers. Other high-risk HPV viruses include 31, 33, 45, 52, and 58, and a few others. And low-risk HPV strains such as HPV 6 and 11 cause about 90% of genital warts, which rarely develop into cancer. These growths can look like bumps. Although there are 3 types of vaccines, only the 9-valent vaccine is available for use in the United States. The 9-valent human papilloma virus, also known as 9-VHPV, prevents HPV 6, 11, 16, 18, and then also 31, 33, 45, 52, and 58 non-infectious virus-like particles, also known as VLP. Administered to adolescents as young as age 9 years, but usually ages 11 to 12 years old. If an initial dose is administered before age 15, only 2 doses are required, and the second should be given 6 to 12 months after the first. If the initial dose is administered after the 15th birthday, 3 doses are required. The second dose is recommended 1 to 2 months after the first, and the third is 6 months from the first. There are 2 vaccines for zoster, or for shingles. So there's the Zostavax, and then the commonly used zoster vaccine, which is the commonly used zoster vaccine, and Shingrix for the prevention of herpes zoster. Herpes zoster, also known as shingles, is an extremely painful condition caused by the varicella zoster virus and also causes chickenpox. Zostavax is a one-time live attenuated vaccine approved for patients 50 years of age or older to prevent reactivation of the zoster virus that causes shingles. The vaccine does not prevent post-herpetic neuralgia. It can be given to patients who have already had shingles, and it is used in contraindicated. Its use is contraindicated in patients with hypersensitivity to neomycin, gelatin, or any component of the vaccine. It is also contraindicated in immunosuppressed patients or those receiving immunosuppressant therapies, as well as in pregnant women. Because it is a live vaccine, there is a risk for transmission of the virus from the person who is vaccinated to other people. The vaccine is not to be used for the prevention of chickenpox and is not given to children. The drug must be stored in a freezer, and Shingrix is a new recumbent vaccine that is given in 2-dose series. So the Advisory Committee of Immunization Practices recommends Shingrix over Zostavax because it appears to provide greater protection and there's less concern for waning immunity. Disadvantages include 2 doses versus 1 dose and an increased risk of mild to moderate side effects, such as pain at the injection site, malaise, fatigue, headache, and fever. These side effects usually resolve in 1 to 3 days. Shingrix is recommended to be given to those who previously received Zostavax. And that's all for today on immunity and vaccinations, and thank you for watching. If you have any questions, please post them below, and I will answer them for you. Thank you so much.